Everyone. Today we're going to talk about myocardial infarction, or common term as a heart attack. So what is myocardial infarction, or commonly known as heart attack? It happens when one of the coronary arteries is blocked by a thrombus or a blood clot, and it can cause an extremely slow blood flow in our heart. So, if there is a slow blood flow, that means that there is a decrease of oxygen supply in our hearts and also to our entire body. One of the main causes of a myocardial infarction or heart attack is what we call the atherosclerosis. As you can see on the left side of the picture, they show the normal uh, picture of the artery, and it shows there that there is a good blood flow in our coronary arteries or in a artery in our heart. However, when you look at the right side of the picture, you see that there is a atherosclerotic plaque. So how this atherosclerotic plaque started? So at first there's like a little blood clot that attached to the wall of our arteries, and then after that small clot, there's a as the years go by, there's a fatty deposit, and they keep attaching and attaching until they become thick. And what happened is the passage of the blood in our heart started to decrease, and that can cause an arrhythmia or problem with the rhythm in our heart. And as what I mentioned earlier, that because of the blockage in our heart, in the arteries in our heart, this can cause an arrhythmia, or the rhythm in our heart is not normal anymore. In addition to that, because of the buildup of this plaque, as we exert an effort, the blood supply in our heart is very low than the demand, which means that one example for that is when we walk, we put too much effort on that, and we don't have enough blood supply in our body, but our body needs more blood supply. So the demand is really high and the supply is really low. So that means that the supply and demand of the blood in our body is not even. So what are the risk factors of having a heart attack, or what are the reasons why certain individual having a heart attack or myocardial infarction? Number one, because of a high level of blood cholesterol. Normal value of cholesterol is only 200 milligrams per dl. So above than that, you can be a high risk for having a heart disease. Next risk factor or reason is having a low level of HDL, or good cholesterol. The HDL is the good cholesterol, and the LDL is the bad cholesterol. So the normal values for HDL is above 45 milligrams per DL. Third risk factor is hypertension, or increased blood pressure. The normal value for that is 120 over 80. Some people may say that their normal is 140 over 60 because that's the number that they always get. You're wrong. The normal values has to be 120 over 80, and if you're getting that high all the time, that's not your normal. You're considered hypertensive. Next is the diabetes mellitus, or diabetes. The normal values for that is 100 milligrams per DL, which is for overnight fasting. That means there's no food intake from a day before or within 8 to 10 hours until your test is done. So no food is allowed for that, or else you're gonna get a bad result or a high number for sugar. Next risk factors are having family history of heart disease. So that means that your father, your mother, or grandpa and grandma has a history, I mean, of heart disease, and you acquire that from them. Next is the obesity, and having a cigarette smoker can also cause a heart problem, and too little exercises. So you should have at least 3 to 5 days of exercise for 1 week. For more than 30 minutes is advisable. So, a lot of people are asking what are the signs and symptoms of having a heart attack, because some people they think that these signs and symptoms are due to indigestion. So, if you feel this, having a shortness of breathing, having a chest pain, and if you have a chest pain, you feel like you want to clench the sternum or the middle of your chest, so that's one sign of the heart attack. You feel nauseated, or you're already vomiting, feel a jaw pain, you're sweating, even you're just sitting on the couch and you're already sweating, and you feel so dizzy. So um, these are all the symptoms that a person is having a heart attack. Attention, attention. If you feel all these signs and symptoms, don't think twice. Ask your roommate, whoever person next to you, to take you to the emergency room or emergency department, or call 911. This is an emergency situation that you cannot wait, or you don't have to wait. You have to go ahead, okay? So, how are we going to prevent having a heart problem or having a heart attack? Number one, exercise regularly. As always, the doctors said and the physical therapists tell you that you have to exercise more than 30 minutes a day. You have to do it 3 to 5 times a week. Next is you have to eat healthy foods. You have to eat fruits and vegetables. Number three, not using tobacco products. Number four, your blood pressure should be controlled. That's why if your blood pressure is higher than 120 over 80, you have to go to the doctor, get checked up in order for the doctor to give you a medication to control your blood pressure. Next is lowering LDL or the bad cholesterol. Any questions, you can send me an email to odessamorales.pt@yahoo.com or odessamorales.pt@gmail.com, and I'm happy to answer all your queries. Please, thank you for watching, and please subscribe my channel. Thank you. God bless to everyone.